My name is Claire Bennett, and I want to talk about a major problem currently happening in the Greater Toronto Area. Youth drug addiction is a serious issue that needs to be addressed, and the Centre for Addiction and Mental Health, CAMH, has taken on this challenge. Generally speaking, alcohol and other drug use increases through teen years and peaks in the mid-late 20s. Unhealthy habits and behaviors such as smoking, drinking, and illicit drug use often begin during this age period and are closely related to increased mortality rates and represent major public health challenges. Addiction is any behavior that gives temporary relief and pleasure, but in the long term causes harm and typically severe consequences. The question then lies, why are youth experiencing pain? Why are some people more vulnerable to drugs than others? And what is happening to youth that they need chemicals in order to live their daily lives? The stigma behind addiction is detrimental to the recovery of drug addiction. 40% of respondents to a 2016 survey done by CAMH agreed they've experienced feelings of anxiety or depression, but never sought medical help for it. The current system is failing them, and it is our responsibility to start building the proper programs to help them. The main reason I'm speaking with you today is to pitch the idea of implementing programs using schools as an important point of access, while also ensuring additional services are available to youth no longer in school. 70% of mental health problems have their onset during childhood. 34% of Ontario high school students indicate a moderate to serious level of psychological distress, including anxiety and depression, and 14% indicated a serious level of psychological distress. As well, people with mental illness are twice as likely to have a substance use problem compared to the general population. School-based interventions compete for class time with the demands of the educational curriculum. If teachers can't find enough time to fit preventative interventions into their class schedule, then they may implement programs incompletely or not at all. Additionally, they are not targeting early enough before youth drop out or stop attending class. Youth in the Greater Toronto Area are currently unaware of the consequences of drug use and the short and long-term effects. Once drug use has begun, they are unaware of the programs available or the resources that can begin to help them tackle their addiction. The programs I'm recommending will include specialized treatment services available in elementary, high schools, and CAMH clinics. Our growing body of international evidence demonstrates that promotion, prevention, and early intervention show positive returns on investment. Efforts are going to be concentrated on early identification, awareness, and prevention programs and routine monitoring. Enhancing social skills, problem-solving skills, and self-confidence are also goals of the program. Addressing problematic substance use through better access and engagement with evidence-based addiction treatment will help improve the overall standard of living of youth in the GTA. CAMH-trained professionals can spend more time during this critical period of youth addiction with more hands-on access and the ability to monitor early signs of addiction. Risk factors include difficult temperament, low self-esteem, family dysfunction, parent unemployment, absence from school, and many more. CAMH professionals can take on students at the schools directly to remove the barrier of transportation to and from clinics. Programs can educate youth on ways to cope with mental illnesses without substance use and can highlight the long-term risks of drug use. It can also offer a safe environment for tackling the underlying issues with current drug users and offer a support system if they are lacking parental support. Programs can also show the connection between mental illness and drug use. I'm looking to achieve a decrease in the amount of youth becoming addicted to drugs and causing adverse effects on their lives. By addressing youth mental illness in elementary and high schools, it will reduce the amount of unemployment, poor health, suicides, mental illness, and decreased life expectancy. Help from high school and elementary school systems will be needed. Parents must also be taught effective theory-based parenting skills and to provide them with information to reduce family or parental stresses. I believe it is important that programs are specialized to target individual needs and to invest more time into ensuring that programs are not generalizing addiction as an overall category. There must be an understanding that personal life experiences and adopting program modifications to accommodate each individual is crucial. The reason my framework will work is because it depicts the individual. I know I've spoken a lot today, but to summarize, by removing the stigma behind drug addiction, addressing addiction issues at an early age, and having programs be more case-specific to adopt individual needs, we will be able to start help tackle that drug addiction in youth in the GTA. Thank you for taking your time to listen to me.